And I'm delighted to represent the development of integrated care for older persons here in Galway, Mayo and Roscommon. And I suppose just as I start, I think it's really important that we all understand why older people need integrated care and what integrated care actually means for them. For older people who are frail, possibly cognitively impaired with mobility issues, it is sometimes very daunting to try and navigate our healthcare system. And in the past, they may have presented on multiple occasions to the acute hospital setting in order to access the care and support that they required. This model unfortunately results in bad outcomes for older people and can lead to loss of function and increased risks of readmissions and admissions to nursing homes. However, with the development of these integrated care pathways, we have the opportunity to develop end-to-end pathways for people, for older people who need this care. And this is an alternative where they can access comprehensive geriatric assessment, which is coordinated, and we try and deliver it as close to their home as possible, either in the ambulatory care hubs, in their own homes, or at their local primary care centre. The vision of this service is to empower healthy ageing in people's homes and communities. This service has evolved over the last few years with initial Saolta Care funding followed by the ECC funding, and we now are fortunate to have 4 integrated care teams for older people and 4 frailty type teams at the front door of Mayo, Roscommon, Portiuncula and Galway hospitals, which link very closely with the community teams. The teams consist of consultant geriatricians like myself, specialist nurses, physiotherapists, occupational therapists, speech and language therapists, dietitians, social workers, therapy assistants and our administrators. The older person receives a holistic assessment which focuses on their needs with a huge focus on maintaining physical and cognitive independence, minimising use of medications where possible, and building the supports and wraparound services in the community which allow them to remain at home for as long as possible. There's also a strong focus in this programme on improving the inpatient care and the transitions of care for people from hospital to short stay to home. And this often happens at the front door in ED, where patients might be assessed by a frailty first or frailty at the front door team. If they're able to go home, they can be linked with the integrated care team in the community or maybe community reablement beds, so that when they're discharged, they have this continuity of care. Feedback to date from older people who have used this service and their carers has been very positive. They feel listened to. They feel they have been given time and that their needs are addressed in a holistic way. Most importantly, they feel they have a point of contact with the healthcare service which is responsive when things go wrong and when they need more support. We're now going to show you a short video where some of our team members explain what they do within the integrated care teams for older people. Thank you.
I go to reception when the patient arrives and I meet and greet them and bring them up to the multidisciplinary team and help them to relax, I suppose, on the way up, just to settle them.
Part of my role is to support the multidisciplinary team and to help organise and schedule the patients both in our Castlebar base and our outreach hubs across Mayo.
As the first community connector in the post nationally, my role is to connect older people back in with the community organisations and services to increase their social support, health and well-being. Together with the older person, we do a well-being plan and that empowers them to take control of their well-being.
I think it's a terrific place. You come here, you're seen straight away. And the staff are so lovely, so friendly.
I assess older persons with complex healthcare needs, such as recurrent falls, frailty, dementia, and polypharmacy. And as a team, we deliver a patient-centered care plan with a multidisciplinary approach and under the supervision of the consultant geriatrician.
I commence the comprehensive geriatric assessment. I'm able to perform a full episode of care from admission to discharge, including assessment, diagnosis, treatment and review. I usually see the older person in their own home and bring follow-up into the local primary care centre. I identify issues for the older person and try to perform interventions to address these. I present the older person to the consultant geriatrician and refer on to the relevant multidisciplinary team members. I am a direct point of contact for the older person and their family.
I assess the client's mobility and overall function. I look at their strengths, balance and coordination amongst other things. So together with the older person, we set physiotherapy treatment
treatment goals, and along with the physiotherapy assistant and wider multidisciplinary team, we instigate an action plan and programme in order to meet these goals.
It was extraordinary. The staff were wonderful. I was delighted with it. You're treated here like a person, not like a number.
We help the older people that we work with to overcome or work around any problems they might be experiencing in their daily life by looking at how their health condition affects them.
We help older people to find practical solutions to everyday challenges that they have. For example, physical interventions like helping them to get in and out of the bed or hanging clothes on the line.
We also explore how to make the most of your memory and the concentration if that's something the older person is worried about.
What matters to the older person, their hopes and wishes, is our focus.
The role of the dietitian was to guide and support the older person in their dietary choices with the aim of helping them to improve their nutritional status. This involves carrying out a thorough nutritional assessment. So from this, I can calculate the person's individual dietary requirements, and then I develop a tailored care plan to suit their specific healthcare needs. And once this care plan has been agreed with the person, it's reviewed at intervals to make sure that it continues to meet their healthcare needs ongoing.
I carry out geriatric comprehensive assessment with the patient. I work very closely with the advanced nurse practitioner and the consultant geriatrician to identify issues from the assessment and to develop and implement a plan of care. I monitor and evaluate the plan of care and make adjustments accordingly in consultation with the team. I also coordinate investigations, treatment therapies, patient follow-ups and referrals. And I work very closely with the patient and the family to provide support, education, self-management strategies and information if required.
I have to carry out a social assessment on the patient. I usually meet with the patient and sometimes a family member, and we look at things like home environment, their formal and informal supports and their health and social care needs. From there, I would usually refer people to community supports and services. A big part of my job would be to help people with future care planning and also to help carers who are experiencing carer burnout.